so much for joining us. Can you please tell us why investing better in primary health care is so important? And secondly, how can increasing PHC facility autonomy support the efficiency but also the effectiveness of PHC financing?
In our Lancet Commission on financing primary health care, we had a core message, which is that countries need to spend more and spend better on primary health care. And so by better, what we meant was that that countries need to arrange their finances in ways that ensure that the money reaches the primary health care level, and that in doing so, it embodies the incentives that are needed to deliver care in a way that is flexible and responsive to patient needs, delivers high quality services, and does so in an efficient way. The spending better bit is important because that's where the issues of incentives come in. So we talked a lot about the provider payment mechanism through which resources are transferred to these facilities. And what's really important from the autonomy perspective is that the incentives can only bite, they can only work if the facilities have the autonomy to respond to them. Why
actually do we need to bring ministries of finance into health policy discussions, such as whether and how to increase facility financial autonomy?
Well, the ministries of finance are the owners of public financial management processes, and those apply across government to all sectors. These public financial management processes can get in the way of autonomy, placing barriers in the way of flexible use of resources. So, for example, if I need to transfer some funds between line items, if the processes for doing that are complex or time-consuming, then that really undermines the ability of facilities to exercise that autonomy. And so it's really important for ministries of finance and ministries of health to come together to hear from each other, to listen, to understand each other's language, to understand each other's concerns, and also, I think, from both sides, for the Ministry of Finance to know what it is that the Ministry of Health really does. What does healthcare delivery look like? What are the sorts of flexibilities that are needed at the provider level to deliver good quality services? At the same time, for the Ministry of Health to hear what the Ministry of Finance's concerns are. Once they have that understanding, they're in a much better place to be able to co-produce solutions that get over some of these barriers.
One last question. What benefits do you see in CABRI bringing together officials from different countries to actually learn from each other's experiences?
Well, I think there's two things that are going on here. So one is that the country teams here bring people from ministries of health, ministries of finance, and ministries of local government. So there's a tremendous opportunity for them to build an understanding and to build the trust that will allow them to co-produce solutions and reforms going forward. Then, of course, when you have comparisons across countries, you have the chance for countries to hear about the experience of other countries that are at different stages of the reform process, to learn from practices that have proven to be successful, and to think about where those can be adapted and applied their own settings, and hopefully also to hear about where they've run into blockages or made mistakes, and to be able to share those so that others can learn from their experiences and their challenges as well.
Thank you so much, Professor Hanson. Appreciate your time.